Hello, everyone. I am here with Dr. Patrick Freud from Montreal today. I have invited him on behalf of the charity FND Together to and in celebration of FND Awareness Month to come speak with myself, and we will be recording this discussion concerning FND. I myself started consulting with Dr. Freud in 2021. My FND was triggered following a car accident in 2013. I was diagnosed with FND, particularly functional neurological movement disorder, in 2019. And during COVID, in 2021, I heard about Dr. Freud and his clinic in Montreal and started consulting with Dr. Freud. And he was very, very helpful for me and my husband as well in educating us on the condition and guiding us in what were exercises that I could practice between consultations to ameliorate, to improve some of my symptom presentations. So thank you, Dr. Freud, for joining us today. And if we could start, if you could provide us with your background, your professional background, with regard to training, with regard to your certifications.
I guess we could start at university. I went to McGill University. I got a bachelor's in anatomy and psychology. Of course, as I had Dr. Freud in my future, so I had to do something in psychology. and and I was going to go into medicine. And one day, the university invited a chiropractor to speak to future candidates who were hoping to get into medicine at McGill. And the dean of medicine was going to speak. Just before he spoke, a chiropractor spoke, and it was one of these illuminating events for me. And I said, gee, this sounds really interesting. I went into chiropractic, did that in Dallas, Texas, came back home after a few years of teaching in the US, and got certified in functional neurology over time, and opened a clinic in Montreal in 2000, the Freud Clinic, which is a multidisciplinary clinic. Practice as a chiropractor mainly, always with a bit of neurology in my mind. It's something I've always loved. And in the last 15 years or so, I've exclusively worked with patients with neurological problems.
Now, you have an extensive resume, which I will post with the video. And for patients who are, because some of the patients and family members are very new to the condition, and could you define functional neurology for people watching?
Sure. So functional neurology was born out of the chiropractic profession, mainly from a man, my mentor, called Ted Carrick. And basically, it's a specialty, just like any other specialty in medicine. So a medical doctor can go on to become a rheumatologist or an orthopedist. In chiropractic, we have similar specialties. One that is called chiropractic neurology. At its base, it was a specialty, or is a specialty, with an interest in what happens neurologically when we do chiropractic adjustments. So when we lay our hands on people, we do different maneuvers. What happens to the nervous system? What happens to the brain by making these stimulations? And from there, we quickly realized, well, this has an impact on the nervous system. What else can we do to help these patients neurologically? And we developed different strategies, different diagnostic approaches. all based on the function of the nervous system. So the word is really key. Functional neurology is basically a diagnostic approach in figuring out what's working well in a person's nervous system, what may be not working so well, and developing um, strategies, exercises, lifestyle modifications, manual therapies in order to target those areas that aren't functioning well with the goal of making them function better and alleviating the person's symptoms.
Thank you. That's very well described. Um, and does your clinic provide services for adults only or adults and children?
We really see the gamut from newborns to the elderly and everything in between. And we offer different services. So we offer osteopathy, chiropractic, massage, and functional neurology.
Um, FND patients frequently have coexisting conditions, which other health conditions, yes, there's these comorbidities often that can occur with FND and concerning other conditions, neurological, psychiatric, and is this something that you see in your clinic as well? That
Absolutely.
FND patients sometimes have these coexisting conditions.
Yes, yes. So we see the typical symptoms that are often listed with FND. So different movement disorders, dystonias, tremors, muscular issues like muscle weakness, paralysis. Um, we see sensory difficulties as well, like strange feelings, pins and needles, numbness. Um, Comorbidity wise, again, also often related to FND, we'll see people who have cognitive issues as well, memory problems, language problems. Um, and those are pretty typical as far as coexisting. Again, very often connected to FND, we'll see people with anxiety disorders, depression, um, fatigue, sometimes chronic pain as well fits in. And yeah, I'd say that's pretty much the list of symptoms that we'll see, including the coexisting conditions.
Um, could you describe your clinic's treatment outcomes when it comes to the patients that you've seen over the years with FND? And uh, do you see the outcomes being impacted by how quickly the person is diagnosed and has access to treatment?
Yeah, the access to treatment and to diagnosis is a key factor, and the research is clear on that the more quickly somebody gets properly diagnosed, the better their prognosis is. And as you know, and probably your audience knows as well, sometimes getting that diagnosis is challenging. It can take a long, long time and many different visits to different professionals to really nail down the diagnosis. Obviously, once that's done, the treatment options become more available when there's a better understanding of what's going on in the patient's body. Um, so we try to see patients as quickly as possible with that in mind. The success rate is I, it's mixed. To be honest, there's some patients we try different things with and it just doesn't budge. And unfortunately, despite our best efforts, there's some people that we can't help. I would say that the majority of people with FND that consult us do get some positive benefit.
Mhm,
I can confidently say that.
mhm,
And then we have some patients who have a complete recovery,
mhm.
100% recovery back to normal life, no symptoms. And of course, that's what we shoot for. That's what we always aim for, 100% recovery. And of course, those are very satisfying for both the patients and for myself as well.
I can see, yes. Um, could you provide an idea of the current waiting list to consult with you at your clinic?
Yes. So the waiting list is right now is about 7 months. It can vary a little bit throughout the year. We usually, range between 5 and 7 months. We do have a system in place where if an opening comes up, we try to see patients as quickly as possible. But that's sort of where we're at right now.
So then, so you do have a waiting list that a patient could be put on in case
Yes,
you
absolutely,
free up a little
absolutely.
earlier. Yeah.
Yes, yes.
Um, uh, so for FND, um, FND together, we're in contact with patients across the country from various provinces. And so for patients outside of Montreal or outside of Quebec, is there a website that they could access, that they could look up if they're looking for a clinician near them that has a similar training as you? Uh,
Yeah.
is there a website that you would recommend that they look into?
Absolutely. So functional neurology has really crossed over. It's come out of the chiropractic profession, like we said, but it's now being practiced by different professionals, from physical therapists to osteopaths, athletic trainers. These are concepts that are easily applied. So all professions can have access to it, but the main source, I would say the most reputable source for those practitioners who have really gone through the entire program of learning functional neurology and have been certified, have been tested, remains in the chiropractic profession, and it's the chiropractic neurology specialist. It's called the American Chiropractic Neurology Board, so the ACNB, and it's the website is acnb.org. There's a doctor search there, and even people internationally who are watching us now can go there, and they'll have a list and a search ability to find somebody near them.
Very nice. I will include the link to that website as well with the video so that do you know no do you when in my experience with you, I found that there was a lengthy questionnaire beforehand, and it was quite detailed. Also, my first meeting with you was quite lengthy, an hour and a half, 2 hours. You did an evaluation that I found, compared to the prior 8 years, and I had gone through a variety of evaluations, was quite thorough, and you seemed very experienced with people whose senses, uh, where their brain has difficulty processing sensory information, such as, light, visual information, auditory, the whole gamut. Even when I was very symptomatic in your office, you were a person that seemed to be experienced with even some strong symptomatic presentations. And so can you share with us, how did you start, um, your experience uh, caring for FND patients?
Mm. Um, I think it was a road of discovery, to be honest with you, because when I started, 30 years ago, even though I had this interest in seeing neurological patients in general, FND was not something that was spoken of. Um, it's only within, say, the last 10 or so years that we have an official diagnostic guideline. There's different consensus papers that help explain what the condition is, and different treatment suggestions that are backed by research. So when I would see patients with, unexplained neurological symptoms, whose MRIs were clear, and who, that's the classic thing, right? Every other medical test doesn't point to anything, yet this person is suffering with a variety of different neurologically based problems. I was, scratching my head and going into the books, and this was even before internet sometimes. Because when you think about it, like we would actually have to go to a library and open books and do research. And it's over time that, we tend to see patterns with patients and with experience. And we try to make our own conclusions, and then we do the research and try to see if this supports what we've seen in clinic. And it's really been over time that I've learned to understand FND better, that the research on FND has come out to explain to practitioners what it is. And, I'll often think back to patients I treated, and, I would now look back and say, yes, that was an FND patient, and that other one who had, seizures that nobody could explain, that was an FND patient, and the other one who couldn't, move her foot, that was an FND patient as well. So it was really through working with patients and over time that I got to appreciate what FND was, and really develop better ways of examining this patient population and developing strategies to help them.
Yeah, it was for myself just such a relief that I didn't have to explain the condition, because often I was finding and I consulted with a variety of specialists and allied health, but I often would have to explain. And with you, I didn't have to explain much at all. You seem to be familiar with a variety of presentations.
Definitely. And you were and you are obviously very well read on the topic, and that's not everybody's case, right? Some people will consult still not having a clear idea of what's happening to them, or maybe
Yeah,
they've been dismissed, or,
yeah,
pushed aside. And sometimes unfortunately people have negative experiences consulting other practitioners who don't really understand what's happening with them. and
yeah,
and and just the explanation part can be therapeutic, right? Like taking the time to explain to a patient, this is what's happening in your nervous system, this is why you're exhibiting these symptoms,
yeah,
can be very therapeutic. I've had patients break down and crying just from me explaining to them what's happening, and then the relief that they gain from it. So yeah, I appreciate you saying that to me, because it is an important point that the education, and not only from the patient's point of view, but for the medical community at large, this is something that people need to be more aware of in general. It's much more common than we think. That's what the research seems to show. So anyway, bless you for
well,
doing what
and
you do as well, and spreading the word.
well, yes, and what I found as well, which was a relief, is that at no time was there any question, uh, that I was faking these symptoms or exaggerating, or there was none of that in my interaction with you. You seem to have a really solid understanding that it wasn't voluntary, that you seem to understand the different aspects of the automatic movements versus voluntary movements and all the nuances in between. And that was very important to me as a patient, not to be questioned in that way, because by the time I had consulted with you, I had spent, years also consulting in various domains of health, psychiatry, psychology, and certainly the psychological support that I received over the years was very, very instrumental in me maintaining my mental health. But with regard to, the multidisciplinary and the important role that the physical therapy can add for patients. But, we hear about physical therapy, but it was very difficult for me to access a physical therapy in the private sector. I was told they were in the public sector, but I was having difficulty accessing. But we don't hear as much about chiropractors.
Mhm.
And traditionally we think about chiropractors as them doing these, skeletal adjustments and things like that. But you took a much broader approach. And that actually we never, in all our appointments, there was never any hard adjustments. Actually,
Yeah.
you took a completely different approach. So yeah, so I would have very much I wished that you were a clinician. I wished I had found, had the opportunity to consult with really early on, years ago. But even myself, after 8 years having dealt with the condition, my consultations with you were so, so helpful. I found, even though I still have, symptoms that can be disabling at times, sometimes multiple times a day, sometimes, once I may go, several days without being symptomatic. But what I found is that it really, I was able to recover faster from episodes of hypomobility or hypermobility. And the quality, it really enhanced my quality of life. I found that I was able to, volunteer more regularly, more consistently. So for me, it made a really big difference, and that's why I wanted to, share with the groups, just for them to know that you're there. With regard to videos, when they come and consult with you, is it helpful for you? Because the presentation of the symptoms can be very dynamic and unpredictable sometimes. So there may be some symptoms that then may or may not present in your office. Do you encourage patients to provide you with videos of your symptoms
Yes, absolutely.
consulting
So
with you?
yeah, video is a brilliant tool for movement disorders in general. They're already, not the easiest thing to diagnose. There's many different types of movement disorders. And when we add in FND, they have their own peculiar nature that doesn't really fit the other movement disorders. So you're absolutely right. A patient can come in and describe what they're feeling, or they might be able to write it for me in a questionnaire. But until we really see it, that's really the beauty of being able to diagnose it. So if they're having a great day one day and they're not exhibiting any sort of movement disorders in the clinic, as an example, or seizure, for example, then a video that they've taken beforehand is very helpful. In fact, part of our intake procedure is we send out a questionnaire, and we want answers to certain questions. We also ask for them to send us the reports, all medical reports, imaging, etc. We really have a let's not leave any stone unturned kind of approach. We want to be thorough. And part of the questionnaire actually invites people to send video if they feel that would help us understand their condition. So there's a link to a private platform where I can visualize these different, you know, different symptoms that are better viewed than explained.
Yeah. And because in my experience, it is so important to consult with a clinician that actually has an understanding of FND, because the type of rehabilitation, for example, if your leg is injured, the type of rehabilitation is going to be very different than a person with FND, even though a leg weakness caused by injury is different than leg weakness caused by the neural pathways not communicating properly in the brain. So when they a rehabilitation, a physical rehabilitation is applied in the same way for both conditions, it does not help. So
Absolutely.
the knowledge of the clinician is so important, because if not, it can really backfire.
Yeah.
Yeah,
And to touch back on what you were saying earlier with your particular case, you know, the tools that we use to try to help improve the function of the nervous system can be exercises that you do at home, which is what we focused on. It can also be lifestyle changes, stress management. We can touch on nutrition because these things have an impact
yes,
on the nervous system.
yeah,
And sometimes we will do some manual therapy or some exercises in clinic, depending on the case. And that could be chiropractic, or if the patient's profile suggests, you know, I think osteopathy would work better for you, or
yeah,
sometimes even massage or physiotherapy. We can sort of fine tune what I think the person needs most, to have a best result and a most efficient result.
yeah. And with regard to people, for example, with speech, because a lot of FND patients may have issues with speech. Is this is this what do you find that this approach can also assist people with speech issues?
Yeah. Yeah. So
Have you
so
seen that as well?
I have. So it's this idea that everything's connected. I know it sounds a little cliche, but
No,
but
no.
sometimes uh, if you find an entry point into the nervous system that can affect other circuits, you can have an impact on anything, really, theoretically. Sometimes a more specifically trained practitioner uh, will be helpful. For example, so a speech therapist, for example, may be a great idea for a person. Or perhaps it's by doing an exercise related to the cerebellum, because the cerebellum controls coordination of the body, the muscles of the body, including the muscles of the lips and the tongue and breathing. So it's particular to the case, but I would say as a global point of view, if we know it's functioning well in the system and we can use those viable circuits to have an impact on circuits that aren't working as well, then anything is possible.
Um, and what do you see in your experience? Because you've been in practice for many years, and what challenges do you still see remaining with regard to the FND community, and what evolutions have you seen over the years?
Uh, there's been great evolution. There's been great evolution because when you look at FND in particular, as you know, its origin was very much based in, concepts like hysteria or conversion disorder or somatization. These are concepts that basically, and FND was very much a diagnosis of exclusion. So
for many years. Yeah.
the typical procedure was, we've ran all these tests. I don't know what's wrong with you. It must be psychological, right? Go
Mhm,
see a psychiatrist, go see a psychologist.
mhm,
That's changed now. It's no longer a diagnosis of exclusion. There's diagnostic criteria that can be used to pinpoint the diagnosis of FND, and that's only, about 10 years old or so. So there's been great evolution. This has been very positive to inform the medical community and give this diagnosis more credibility in a way that you would think and you would hope, and I believe is allowing much less dismissal of these patients, and a better understanding, a better empathy towards these patients. So I think there is some evolution. Within that, there's still challenges. That it's still a relatively unknown condition, even though it's relatively common. There's research that shows that it's second only to headaches as far as presentations into a neurologist's office, more than multiple sclerosis, for example. So this is big. This is huge. There
mhm,
needs to be more awareness, clearly. Um, other positive things is there's more and more research coming out as far as understanding what's happening in the brain of somebody with functional neurologic disorders. So while most imaging studies, typical MRI won't show anything, there's research based like functional MRIs that are showing that the brains of people with FND are different than people without FND. And again, it's all in the circuitry. It's all in, how are things firing? What is the timing of that firing? How are things connected or not well connected in the brain? What areas are strong? What areas are weak? Um, so I think I think there's a very positive evolution, but there's still a lot of work to be done.
mhm. Dr. Freud, do you provide training with regard to FND to other clinicians?
Yeah. So I give lectures on functional neurology in general. And I give these, I've given them especially in Europe and across Quebec. I'm giving them more and more now across Canada and in the US. And FND is FND is a really uh, classic condition that fits into what we do in functional neurology, because functional neurology is really based on understanding the function of the nervous system in the brain and developing strategies to help those whose connections maybe aren't as strong as they should be. So, yes, through that, as we're talking about raising awareness with the work that you do, through lectures in my own way, I'm also raising awareness for FND.
Wow, that's wonderful to hear because that's so important, the training, because what we often hear from patients is that is the difficulty in so the hearing when we hear of these training and how would they if a clinician were to decide, oh well, I want to uh, take part in one of those lectures, attend one of those lectures. Is this something that you do through the university or through your clinic, or how would a person access your training in
It's
functional neurology?
the name of my lecture company is called Adjusting the Brain.
Oh,
And
okay. Well, let's straight that like that.
and
Adjusting.
there's a website that people can go to, adjustingthebrain.com, to learn more about functional neurology, about the seminars, where they're being given, what the course content is, etc.
Okay. Well, I'm going to put that link as well because that I think that's very important. Um, is there anything else before we stop the recording that you would like to add that you think that we haven't covered, or just advice that you could give to patients, their families, parents of children with FND?
Um, I think maybe just circling back to what we were just talking about, a message to practitioners who may be watching this is to learn about this condition, because as we were saying, it's more common than we probably think as in a clinical community. And it really offers an opportunity to better understand the brain, how it functions, and to understand how things are connected, really. We talk often about this biopsychosocial model, and sometimes we tend to focus more on the biological physiology of what's happening to a patient, or we jump out of that and talk about their psychology and their stresses and their, past traumas. And then the social part is actually often forgotten, but the social part is super important. It's and that's very clear in the research. It just kind of makes sense. um, People with FND aren't suffering alone in a bubble. They don't have it by themselves. They share this with their spouses. They share this with their kids and their parents. And it's something that, if there was a message that I would offer, it's don't stop learning about it. Number one, because there is more and more information coming out that helps us understand it. When we understand it better, like we said, that can be therapeutic.
Yes,
Um, and it allows us to it allows patients to maybe seek the right professionals as well, because every FND is different, right? Every brain is different.
yes.
So what might work for one person may not work for another. So never stop learning, never stop searching for answers, never stop looking for help, because sometimes the right person or the right technique is out there, and it'll make a world of difference. We know that this is a reversible condition, and I would just say don't lose hope.
Sounds so wonderful. Thank you very much, Dr. Freud. I really appreciate it. And just one last question, just because if there are patients coming out, do you sometimes see patients from outside the province?
Mm. Yes, it happens.
Mm, okay.
We try to have a in-person first meeting,
Yeah,
because it's important to really examine and to touch the person and to do different tests.
yeah.
But afterwards, there is a possibility of doing virtual consultations, or I can work with somebody who's local for the person. I often will do, communications with other practitioners so that we can do a teamwork approach to help the person.
Okay, okay. Well, thank you very much. And I really, really appreciate you doing this, and for being there. I've currently, as you know, moved to Ontario. If I could have had you move to Ontario, yeah, that would have been my choice. Um, but it was just I wanted to do, just have this discussion because you played a really positive role in my life, in my husband's life. And so I just wanted to thank you, and I wanted to share it with other patients that may be looking for a practitioner that understands FND and that can guide them. Thank you very much, Dr. Freud.
Thank you, Susie. I appreciate your kind words, and all the best to you. It's
Okay,
been a
thank you.
pleasure.
Oh, bye-bye.
Bye-bye.